We know now how to keep our animals comfortable, so the next challenge is how to keep them alive, so then we can work on making them comfortable. So this session is more anesthetic management in animal shelters and really focusing on what we can do better to keep our mortality statistics low. And certainly I'm going to go through quite a lot of different things, including some historical data. But what I'm going to focus on and what I think you'll go away with is specific things that you can go back and focus on that will make a difference in your outcomes and your mortality. So the talking points are really going to be some historical data on anesthetic mortality in dogs and cats, and then some of the most recent data that we have, evidence-based medicine. What does it all tell us? What should we be focusing at? Is there data out there that has identified at-risk patients? And the answer is yes, there is. So I will help you try and identify the high-risk patients. Whether or not certain drugs or techniques that you're using may be implicated in higher or lower mortality. And then, of course, focusing on, now we know who's at risk, how we could, go ahead and try and make things better. So I like to start with this slide. I mean, there is more to good anesthesia than life or death. This is a quote from Jamie Gaynor, who I've worked with a lot. He used to be at Colorado State University. So just not having a dog or a cat die is no longer the criteria for good anesthesia. There's an awful lot between living and dying when an animal comes in to have a procedure. And I think that's very important to keep in mind. But we're going to talk most importantly about the black and white mortality. So again, going back like I did in the first talk, what kind of questions do I get asked a lot? I get asked a lot about for all sorts of situations, but specifically shelter situations. Is it injectable only or injectable inhalant combinations? Which one's better? So on. A big question I get is how young or how small is too young or too small. And I think there has been a lot of emphasis on that we have got to get better at doing very small pediatric patients. But as we go through this talk, you'll see that because of their size, some of those patients are in that high-risk category. And then another question I get asked is it okay to mask animals down? And I will address that question and give you the yes or no answer this afternoon. So certainly morbidity, things that go wrong, very, very common. Things go wrong, but it's very, very difficult for us in the veterinary community to document morbidity issues. So problems with classifying it. What is hypertension? Some people have a different classification for that. And obviously, if you're not monitoring blood pressure, then you obviously don't have any issues with hypertension, right? Consistency of reporting, and then intraoperative complications, postoperative. Are we looking at outcome? Do they make it, out of the operating room, or do they make it out of the hospital, or do they make a really good recovery weeks or months later? So mortality is what we're going to focus on. Fortunately, it's a lot less common to have an anesthetic death. It's pretty black and white, single outcome. So that is data that we can very, very easily get from good studies. So when we're looking at an outcome, obviously we always want the dog and cat to end up this way and not this way. But there's so much involved in a good outcome. We have patient factors. We have hypothermia. I'm going to spend quite a bit of time on the impact of hypothermia on the outcome. Procedural factors, personal experience, human error. We're going to talk about, what's the commonest human error that results in a death in an animal? What about monitoring, anesthetic management, and so on? So lots of factors are involved. So historically, the veterinary community has been collecting and documenting mortality data. So from between 1955 and 1969 in the United States, the documented overall mortality for dogs was between 0.23% up to just over 1%. And then it's always been tended that cats have a higher mortality rate. So that was reported to be between 0.35 and up to almost 2% mortality rate. And then more recently, a very large study was done in the United Kingdom between 1984 and 1986. And what they showed was overall mortality by about 0.23%, higher in cats. But what they showed was there was a difference, as we intuitively thought, between mortality in healthy and in sick animals. So sick dogs and cats, pretty high mortality. So you'll be interested to see whether or not that's improved in the more recent data. And then if you look at the healthy animals, that was the mortality in between 84 and 86. So the new data that I'm going to go through, because it really has changed how I practice anesthesia, because now we really should be focusing on evidence-based clinical practice. You know, is there good data out there that says we should change how we do things? There is with anesthesia. It would be nice to show that things have improved, and luckily they have. But it was time to do a new study, because since that 86 study, there's been new drugs come out in the veterinary market, like medetomidine and dexmedetomidine replacing xylazine. Propofol came on the market, and isoflurane and sevoflurane were beginning to replace halothane. And then the other thing that's happened more recently is new monitoring techniques that are being better embraced in different practices. So the study that I'm going to focus on is this excellent study that was conducted in the United Kingdom by David Broadbelt and his group at the Animal Health Trust and London University. So it was conducted between 2002 and 2004, and there's been there's actually 5 very good papers have come out of this study. And I'm going to show you and share with you the highlights and why this study has made me change what I do. So, sedation or anesthetic-related death in this study was defined as a death in a dog or a cat where the surgical or pre-existing medical causes did not solely cause that animal's death. So they were able to say quite sincerely that it was something about the anesthetic that killed that dog or cat or resulted in that dog or cat's death. So the way the study was done, it was a very, very well-designed study. They did a pilot study to look at how many dogs and cats they would need to have a lot of power and so on. So they had 117 participating centers, and this ranged from referral centers, university centers, and general practitioners in the United Kingdom. And what they did was they had everybody who was enrolled had to submit their data, whether or not the animals died or were alive 48 hours after the procedure. And what they did was they looked at the anesthetic and sedation-related deaths. They took randomly selected records from the dogs and cats that survived, and they compared these. What was it about this group that why they died compared to the animals that went out of the hospital and were still alive 48 hours later? So that is how they set up the study. Very, very sophisticated statistics and everything. So what they did was, the other thing is you'll be impressed, this is not based on a few dogs and cats. There was 98,000 dogs in the study and almost 80,000 cats. Anyone that has to work with rabbits, there is some excellent data out of this study that is going to be published on mortality and complications in the rabbit. And then while they were at it, they just decided to collect a lot of other information on things like ferrets, hamsters, chinchillas, and birds and stuff. And just to reassure you that none of us want to be bird veterinarians, the number 1 award for mortality was the budgerigar. 13% mortality. It was it was bad. So it got the award. And dogs and cats, luckily, a lot less than that. But we're not going to talk about the birds anymore. So overall, what they reported was, they had their 98,000 dogs and 80,000 cats. So overall, the risk of death in a dog was 0.17%. So 163 of the dogs out of the 98,000 died. And in the cats, the overall mortality was higher at 0.24%. And then if you try and look around for other data and how well other people are doing, I pulled out this study. This is a study that was done here at the University of Florida looking at our TKX protocol. And it's very, very reassuring that we have excellent mortality data, considering that we don't know a lot about these cats that are coming in. So overall, mortality was 0.35% in the Operation Catnip here, but the actual related to anesthesia, 0.23%, which is very similar to the SEPSAF data for what mortality rate runs at in general practice. So that was very reassuring. So when do most deaths occur? And this leads us to where we could focus on making things better. And this is very interesting information. So not many animals die after they're pre-med, and very few die at induction. With dogs, about half of the deaths, or less than half of the deaths, occur during anesthesia. In the cats, it's less than 30% of the deaths occur during the procedure. Where the problem arises is post-operatively. That is where most deaths occur. So over 60% of cats die post-operatively after we're done, and almost 50% of dogs. And then if you look at that data even more carefully, when in the post-operative period are dogs and cats dying? And it's pretty clear in the first 3 hours. So we have to kind of sit back and go, so why is that when most deaths occur? And we can come up with lots of reasons. But what it means is that we should be focusing on having better staffed recovery areas, and then looking at what is it that happens in those first 3 hours that's causing this high incidence of mortality. So what about the health status? So intuitively, we would kind of assume that sicker animals have a higher mortality. So in this study, everybody that filled in the paperwork was asked to assign a health status to the dog or a cat. And they used the American Society of Anesthesiologists assessment. So a healthy animal is ASA 1 or 2, a sick animal is ASA 3 to 5. So what they found was that healthy animals had a lower mortality, and the sicker animals had a higher mortality, but a lot less than 3.3%, which was the sick mortality data from back in the mid-'80s. So things had improved there. So overall, we've got cats and dogs, and then in the healthy, we have healthy dogs and healthy cats, and that is the mortality. So less of a chance of dying if you're healthy when you go under anesthesia than if you're sick. So intuitively, that confirms what we probably thought. But again, when we have, certainly in shelters, we have elective procedures. An elective procedure is not always on a completely healthy animal. They may come in for an ovarian hysterectomy. They could be normal and healthy. They might be pregnant. That's going to cause changes. They may be an estrus, or it may be open them up and it's a pyometra. So you may have allotted them to an ASA 1 or 2 status, and actually you assigned them to the wrong status, and there may be more chance that something goes wrong. And then the group of experts that looked at the causes of death and analyzed the reports that came in tried to figure out why they were dying. And it was pretty clear that with a lot of the dogs, it was cardiac arrest. 23% of dogs, it was fairly clear that's what happened. Respiratory complications in 13%. But in cats, it was much, much harder to figure out why they had died. And so most of them, it was put down to either a cardiac or a respiratory event that caused their death. There was a few animals that just didn't wake up, didn't recover from anesthesia. Some that were euthanized post-op for acute renal failure, and then a significant number where they never could figure out why the animal had actually died.